Hazardous chemical spills can happen anywhere in the office. If this does happen, immediately clean up the spill. Take the following precautions. Place material in a biohazardous waste bag. Ensure the bag is leak-proof on the sides and bottom and can be closed tightly. Place the plastic bag in a cardboard box, also marked with a biohazard symbol. Penalties for non-compliance can be rather hefty. You'll notice that willful violations can go all the way up to a $145,000 fine. And if they are repeated violations, which means that they are substantially similar to another violation, that can also go up to $145,000. So you always want to make sure that you're doing your part to keep your facility compliant. To stay compliant with the bloodborne pathogen standard, an employer must meet these requirements. Have a written OSHA exposure control plan that's created and updated annually. Training must be provided to all employees describing the documentation mandated by the standard. And the employer must make the hepatitis B vaccine available at no charge to all employees who are at risk for occupational exposure. OSHA requires medical professionals to follow specific universal blood and body fluid precautions as set by the Department of Health and Human Services, Center for Disease Control and Prevention. These precautions prevent healthcare workers from exposing themselves and others to infections. Following the universal precautions means that you assume that all blood, body fluids, and other potentially infectious materials are infected with bloodborne pathogens. This precaution applies to, but is not limited to, blood and blood products, human tissue, semen and vaginal secretions, saliva from dental procedures. Breast milk is not on the list of fluids, but it is often treated as such because it's been shown that female parents can pass along HIV to their infants through breast milk. Healthcare facilities are now following what we call standard precautions, which are a combination of universal precautions and rules to reduce the risk of disease transmission by means of moist body substances. Standard precautions apply to blood, all body fluids, secretions, and excretions except sweat, non-intact skin, and mucous membranes. In order to reduce the risk of bloodborne pathogen exposure, OSHA does require that every medical office has a written exposure control plan. You might hear it referred to also as an ECP. The ECP must include determination of employee exposure, implementation of exposure control methods, hepatitis B vaccination, post-exposure evaluation and follow-up, communication of hazards to employees and hazard training, record keeping, and then procedures for evaluating circumstances surrounding the exposure incident. If there is an exposure incident, the OSHA bloodborne pathogen standard also specifies what to do. An exposure incident is one in which a worker, despite all precautions, has reason to believe that he or she has come in contact with a substance that may transmit infection. An individual's blood entering another individual's body through an open wound is probably the most common kind of exposure incidents. When an exposure incident occurs, the physician or the employer must be notified immediately. After an exposure, the employer must offer the exposed employee a free medical evaluation. They'll send you to a licensed healthcare provider who can counsel you about what happened, as well as how to prevent the spread of any potential infection. That healthcare provider may also take a blood sample and prescribe appropriate treatment. And don't worry, this is all covered in your employer's worker compensation insurance. The Needle Stick Safety and Prevention Act was signed into law in November of 2000. In response to this act, OSHA revised the bloodborne pathogen standard to include the following provisions. Healthcare employers must evaluate new safety engineered control devices on an annual basis and implement the use of devices that reasonably reduce the risk of needle stick injuries. Healthcare facilities must maintain a detailed log of sharps injuries incurred from contaminated sharps. Healthcare employers must solicit input from employees involved in direct patient care to identify, evaluate, and implement engineering and work practice controls. In addition to strict adherence to standard precautions, the CDC has developed guidelines known as transmission-based precautions. These guidelines are meant as a supplement to standard precautions when caring for patients with suspected or confirmed infection. The transmission-based precautions include 3 categories: contact precautions, droplet precautions, and airborne precautions. Contact precautions is transmission by touching. It's actually the most common means of spreading infectious disease. The 2 subcategories of contact transmission are direct and indirect, as we have previously discussed. You will use contact precautions with patients who have the following conditions or diseases: stool incontinence, severe uncontrolled diarrhea, draining wounds, uncontrolled secretions, ostomy tubes, or generalized rash. Contact precautions include washing your hands before and after touching the patient, wearing gloves, wearing a gown if considerable contact is expected, washing hands after removing gloves, and then disinfecting the exam rooms with EPA-registered disinfectant. Microorganisms can be transmitted by contact with secretions from the nose, throat, airways, lungs, and the digestive tract. This is known as droplet contact. And these droplets can carry up to 3 feet from the source. Think about all the times that you've been in a room with someone when they cough or sneeze. Follow droplet precautions when dealing with patients with respiratory viruses such as the flu or COVID-19. Patients with a droplet transmitted infection should be asked to put on a face mask and placed in an exam room for isolation as quickly as possible. When dealing with droplet transmitted infections, all healthcare providers should put on a mask before entering the patient's room. You should also wear gloves, a gown, and goggles or a face shield if the patient is coughing or sneezing uncontrollably. Don't forget to wash your hands before and after touching the patient or contacting respiratory secretions, and always clean and disinfect the exam room before allowing the next patient to enter. Some microorganisms are able to float in the air for substantial distances. For this reason, we use airborne precautions when dealing with patients who are suspected of being infected with a pathogen that is transmitted through the air. The most common pathogens transmitted by the airborne route include COVID-19, tuberculosis, measles, chickenpox, and in some cases, even herpes zoster. COVID has actually been known to remain in the air for as much as 3 hours. When applying airborne precautions, isolate the patient as soon as possible. If you're able, have the patient enter through a different entrance than other patients so they can avoid the reception area. And place that patient in a special airborne infection isolation room if your facility has one available. If this type of room is not available, you should give the patient a face mask, close the door to the exam room, and instruct the patient to keep the mask on and change it if it becomes wet. All healthcare professionals handling a patient suspected of airborne pathogens should perform hand hygiene before and after patient contact and wear a mask, glove, and a gown. After the patient leaves the room, keep the room empty for at least an hour. And if you must enter the room before the prescribed time, you must use respiratory protection. Now, I know all of this can be a lot to remember. This is why OSHA requires education and training to allow all healthcare personnel to adhere to infection control policies and procedures properly. This training must be comprehensive and ongoing, and the trainers must have documented and demonstrated competency related to the task. Your employer is required to provide you with infection control training at the start of your employment and then on an annual basis or when a policy or procedure changes. Anyone working in a healthcare facility who can come in contact with an infectious agent must be trained. The training must include, but is not limited to, proper PPE selection and job-specific infection prevention.